Hi, my name is Dr. Theresa Kapke. I'm an assistant professor here in the Department of Anesthesia, and I work as a bilingual pediatric psychologist in the James Pettit Pain and Headache Center. I am a proud recipient of last year's seed funds, and I'm here to provide a little bit more information about my clinical research study, as well as an overview of what the seed funds allowed me to do this past year. As a bilingual psychologist, I'm really interested and passionate about improving care for our youth and families from more underrepresented populations and backgrounds, including Latinx youth and their parents and caregivers. We know that these families oftentimes experience a lot of barriers to care, and they're at risk of falling out of treatment prematurely. They also haven't been well represented in the literature, and so this was an opportunity to hear from families directly, to conduct an in-depth qualitative assessment as to what their lived experience is, the needs that they have, and the things that serve as barriers and facilitators of care. It is the hope that this study will provide a lot of valuable information to help to inform future projects and initiatives to improve care for our families, especially increasing accessibility of our services and improving engagement in services. So my study included 10 Latinx families, including both parents and teens. We conducted 1 hour-long interviews with both the parents and teens in either Spanish or English, depending on what their primary language was. And then we also had families complete a series of measures to look at some quantitative data related to medical and sociodemographic factors and constructs like ethnic identity. All families provided consent and assent for the study, and everybody received compensation for their participation. As an early career faculty member, I was fortunate to have some funding to start this project, but it became very clear throughout this journey that I was going to need some additional funding in order to successfully execute this qualitative research effort. The seed funds allowed me to do this. With seed funding, I was able to purchase NVivo software, which has been our primary qualitative research software, as well as a collaboration cloud, which has allowed us to partner with some psychology colleagues at DePaul University, Dr. Susan Tran and her team, and they've been critical to our coding effort. I also consider this to be my first qualitative study as a PI, and so I was in need of some additional mentorship and guidance from a qualitative expert. The seed funds allowed me to be working closely with Dr. Katinka Huyer through this process. Through the Qualitative Research Consulting Service, she's been excellent in meeting with me at various stages throughout the research process to better understand how to make sense of all the rich qualitative data that we have, to organize it in a way that is meaningful and that will make an impact. The seed funds have also provided funding to cover future publication fees, which I know will be really helpful in the months to come. So in total, I was able to get $6,500 in seed funding, and this has been really critical in supporting the study and to helping to make it a success. The current status of the project is that all data collection is complete. We've transcribed and translated all of our interviews, and data analysis is well underway. We're actually working towards the final stages of coding. We continue to meet with Dr. Huyer and her team from the Qualitative Research Consultation Service, and we're in the process of preparing a number of different research products. Right now we're working on some conference symposium and poster abstracts for a national pain and pediatric psychology conference, and we're in the process of planning and preparing some of our manuscripts. Thank you again to the Department of Anesthesia for providing this seed funding program. I am so very grateful. And thank you so much to all my colleagues here at the Medical College and Children's who have helped to make this project happen, especially Dr. Hainsworth, Kevin, and Bryn. Thank you to all this faculty and staff from the James Pettit Pain and Headache Center, to my psychology colleagues at DePaul, Dr. Susan Tran and her team, to Jennifer Flambeau with Equilingua, who's been our certified transcriptionist and translator, and a special thanks to all the families, all the youth and parents who participated. We are so excited to finish our data analysis. We can't wait to share the information back to the families who participated and our community at large. Good luck to all those who are applying for seed funds this year. Thank you again for listening.